Today we will talk about dwarfism and gigantism. So what is dwarfism? It basically means short stature. Now there are several types of dwarfism. First one is pituitary dwarfism, which occurs because of deficiency of growth hormone. Can occur because of panhypopituitarism, destruction of acidophilic alpha cells, isolated growth hormone deficiency, etc. etc. So the person will be having very short stature, but a very important point to memorize here is all the body parts are proportionately small and mental retardation, it doesn't occur. Second type is hypothyroid dwarfism. It occurs due to low levels of thyroid hormones and it is basically seen in cretinism. Very important point to note here is mental retardation will be seen along with other features of hypothyroidism. Third type is psychological dwarfism. Dwarfism in children may be a result of chronic abuse and neglect, also called as Kasper-Hauser syndrome, which is named after the patient in whom it was first reported. Fourth one is achondroplasia associated dwarfism. This type of dwarfism, it occurs as a result of mutation in the gene coding for FGFR3. What does it mean? Fibroblast growth factor receptor number 3, which is basically expressed in brain and cartilage. It is basically an autosomal dominant condition in which the person will be having small limbs but normal trunk. Fifth one is laryngeophism. It occurs because of unresponsiveness of growth hormone receptor because of loss of function mutation. So it is also called as growth hormone insensitivity. Why? Because irrespective of dwarfism, plasma growth hormone level are normal or slightly increased because there is unresponsiveness towards receptor, nothing to do with the levels of growth hormone. Last one are African pygmies. Plasma growth hormone level are normal, but there is moderate fall in the plasma concentration of growth hormone binding proteins. Now one reasoning based question can be extracted out. How pituitary dwarf is different from hypothyroid dwarf? Keep on thinking. I'll answer all the reasoning based question at the last. Now, irrespective of the type of dwarfism as a whole, if we talk about clinical features, there will be short stature, spontaneous fractures even with trivial trauma, immature faces, sexual immaturity because of deficiency of gonadotropin. To treat, we have to treat whatever the underlying cause is if it is treatable. Replacement therapy with growth hormone can be given, or we can give recombinant growth hormone and IGF, insulin-like growth factor 1. Now about gigantism. Hypersecretion of growth hormone during childhood, it leads to gigantism. Childhood is a very important term that has to be memorized. It will differentiate gigantism from acromegaly. Person will be having rapid and excessive growth, and very important point to note here, all the body parts will be proportionately increased.